live. So it
Here
says
we
we're
are.
live. We have to go back to Instagram and make sure we click live on Instagram. Or maybe it
Okay.
happens automatically. I don't know. First time? It's not.
Right.
I've done it so many times. Oh, there you go. It says the button showed up, go live on Instagram. So I just click go live. It looks like we are live. We
Amazing.
we are live. Hold on, let me unmute here. Make sure everything is set up. Okay, we have two people join us on Instagram, so we know it's working.
Yay. Okay,
Mhm.
amazing. I might not get mine to go live, but we'll see.
Oh,
We
is it
will
giving
try.
you?
It's only giving my photo and not yours and mine,
Okay,
strangely.
well, maybe people can just listen on Instagram. If somebody's walking, they can listen like a podcast. As long as
True.
the
Okay, I'll do it. Let's do it then.
Hi, everybody. I love it. We have 12 people joined on
Hello.
Instagram. Hello, hello. Okay, I'm gonna start our official conversation.
All
Hello,
right.
friends. Welcome back to Hashimoto's Nutrition RX. I'm your host, Natalia Sanzo, registered dietitian and fellow Hashimoto's warrior. Today's episode is a really important one because whether we like it or not, GLP-1 medications like Ozempic and Wegovy are here and they're not going anywhere. And if you have Hashimoto's like I do, or if you have been struggling with stubborn weight, brain fog, fatigue, gut health, or hormone chaos, then you've probably wondered, is this something I should consider? Or maybe, is this even safe for someone with autoimmune condition? I invited McCall McPherson, physician assistant, a leading expert in thyroid health and metabolic function, to help us break this all down. McCall has been incredibly outspoken about using GLP-1s with intention, not as a quick fix, not a crash diet, but as a potential tool when it's used carefully, with the right patient at the right time, and with the right plan in place. We'll be talking about NAD plus, BPC 157, and other peptides that my community ask me about all the time consistently, especially for things like fatigue, gut repair, hair loss. So I want you to walk away from this episode informed. Okay. We're not here to promote medical weight loss, but as a registered dietitian, it's my job to help you make empowered decisions, especially when your health feels like confusing and overwhelming. So, without further ado, McCall, welcome.
Thank you so much for having me. I'm so excited to be here. And I'm so grateful that as a registered dietitian and someone that helps optimize nutrition, that you are open to having these conversations and open-minded, because I know we're in a climate that not everyone is, and people deserve to have the information and navigate this landscape in a really informed and empowered way. So thank you for your role in making that happen.
Oh, I love it. Thank you for saying that. I didn't even think about that in that way because I'm here to support my community the way they deserve to be supported. And I know not everybody becomes, well, not everyone becomes my client. I know people gonna go if they set their minds on getting a GLP-1 or any other peptides like NAD plus, that has nothing to do with weight loss. But there's so many questions like, is it safe for us? So I think
Mhm.
you are the best person to have this conversation with. So thank you so much for joining us. Now, before we get going, for those listeners that don't know who you are, I would like to take a
Yeah.
moment to officially introduce you. Okay. So McCall McPherson is a nationally recognized physician associate and entrepreneur, known redefining what it means to treat thyroid, hormone, and metabolic issues, not just manage symptoms. She's the founder of both Modern Thyroid Clinic and Modern Weight Loss, and the owner of Thyroid Nation, where she brings together cutting edge science and deep personal experience to help people truly heal. McCall has delivered a TEDx talk, been named on the top 500 female founders by Inc. in 2025, And her company was featured in the 2024 Inc. 5,000 list of fastest growing health brands. She's also hosts the Modern Thyroid and Wellness podcast, where she educates and empowers listeners to take control of their metabolic and thyroid health, one smart, personalized step at a time. I love that we have a real expert on the podcast. Now, in my bio, I mentioned that you have a personal experience that led you to focus on thyroid health, metabolic function, and eventually, something like Ozempic or similar medication. Can you share your story with us?
Yeah. So I ended up in this field by way of getting here when I was 27. I was completely disabled from a thyroid issue, hypothyroidism. I had already been treated for it, could not get help. And I was spending 16 or 17 hours a day flat on my back in bed. Basically, every moment I wasn't at work, I was resting or recovering, trying to rest away the day's work and rest enough to prepare for tomorrow's work, and just couldn't get the help that I needed. Despite being a licensed healthcare provider, you would think that people might, hey, maybe take me seriously when I say how debilitated I am. And couldn't. And so, eventually I landed in the hands of a physician, waited 3 months to see him, saw him, and he gave me my life back. Quickly became a mentor to me. And I devoured every piece of research I could find on thyroid, learned everything I could, and just incorporated that into my practice. I was practicing integrative and functional psychiatry at the time, all the office for resistant depression due to a thyroid problem. Took my information and spread it all across the internet on a bunch of thyroid advocacy platforms, and they honestly did Modern Thyroid Clinic for me. I didn't know that this was my calling. I didn't know that this was my purpose, and was very fortunate enough to find out that it was. And now I get to help women too, but largely women that were just like I was, get their lives back from complex thyroid disorders. And then, from that 10 years of treating complex thyroid issues leads to a lot of interaction with people with metabolic dysfunction, and healing and fixing someone's metabolism that has thyroid dysfunction is incredibly complicated, incredibly difficult, despite patients' best efforts and an impeccable lifestyle. And so repeatedly, I had these women in my office who were like, listen, I'm doing all the things. I knew they were doing all the things. I was in the trenches with them, diet, exercise, low inflammatory diet, nutritionist, all the things. And they could not lose weight to save their lives. And so, I started digging in really, really deeply GLP-1s, and it's been a sacred journey that I got to work with them, and it's evolved in ways I never expected. And that's incredibly, incredibly rewarding.
Thank you for sharing your experience, because I think, we don't have to have a personal experience to make sure we help people, but I think it makes us a little bit more special and in tune as practitioners, because we make it as our personal goal, thinking we have been there, and I don't want another person, another woman, to go through the same thing, the debilitating symptoms that I went through. So I think it's an important part of our journey. So thank you for sharing. And I know you said a lot of people think GLP-1 medication are just for weight loss, but you see them as much more than that. What is the biggest misconception people have about these drugs?
Honestly, if I had to say it outright, I think the very biggest misconception is that they're an easy way out, that they're for people who are lazy, and that everyone should be able to influence their weight with effort, calories in, calories out scenario. And that is blatantly, medically, scientifically not true. Now that's the weight loss piece. Now, a lot of people end up going on these meds for weight loss. Once they're on them, they realize that the effects of them are far, far reaching, well beyond weight and metabolic issues. And the science and studies show that as well. I've seen just the studies I've run across, and also the experiences I've had with patients, show that these meds truly are going to change medicine forever. They are not about a number on a scale.
Right. And most people that get on weight loss medication, Ozempic or any other one, always say that there are people, a lot of people are doing it all wrong. They're either overprescribed, over medicated, under monitored. So, what is the biggest mistake you see when people get on those medications?
Yeah, I think there is something that's happening nationwide that's very, very unique and different than the experience we have in our programs at Modern Thyroid Clinic and Modern Weight Loss. And what's happening is we are taking data that's a couple decades old for how to treat diabetic patients for diabetes and the doses of these medications to use in diabetic patients. We're extrapolating that data, and now we're applying it to people who are not diabetic, who are trying to lose weight. So that's the first problem. We are applying doses of medication that are far too high for these people. We're also trying to put everyone on the exact same treatment protocol. Hey, for 4 weeks, you start at this dose, then you double for 4 more weeks, and then you double again. And that's just one, unnecessary. These people are being overdosed to begin with, but then they're constantly upping the ante and over medicating people. And there's no unique dosing algorithms happening. We are not looking at how is this person responding? What are their unique needs? How is their physiology handling this to make decisions on how to move forward? We're trying to treat in this one size fits all manner without not keeping track of these people, they're not supporting them, they're not actually clinically treating them. They're just putting them on a medication and being like, okay, good luck, goodbye. And that is causing the side effects that we hear about in the media and the news that are not happening with microdosing, with tailored dosing, and with people who are with clinicians who are invested in their actual protocol and health and their journey on these meds.
Mm-hmm. And your clinical experience obviously has led you to question this standard dosing protocol. And it doesn't matter what part of medicine you're practicing or what medicine you're practicing, protocols don't work for most people. I had to start, just like you, create a truly personalized care plan. I call them care plans because they're not protocols. They're not just a, cookie cutter. This is, like you said, from week 1 to 2, this is how we're gonna decrease food sensitivity. From week 2 to 4, this is what we do. It doesn't work like that because everyone's symptoms are different, how they advance are different. Are they compliant with not just with the medication, but also with what they have to do diet wise? So I think this is the key if someone wants to start a GLP-1 medication. I think the key is to find someone who is not just giving you a protocol, but truly listening to your symptoms and advances you when you are ready, not when the protocol says. So, and a lot of people think, oh, more medication means better result, but in your experience, lower doses often work better, right? And for longer.
It's all about risk versus benefit, pros versus cons. And, I essentially, at these higher doses of medication, almost ubiquitously, you have non-compliance. People stop taking them because they're sick. They're nauseous, they're constipated, they're so exhausted, they're not eating food, they're nutrient depleted completely because they're not eating protein, they're not eating micronutrients, they're hardly eating at all. And so with that comes serious issues, right? If we want to talk about a way to lose muscle mass as we age, which is an incredibly important organ as we age, a great way to do it is to starve yourself and not eat food. So you have to go into it with the knowledge that, hey, conservative is what's going to make the longevity of this medication and program sustainable and get the best possible outcomes with the least possible side effects. I'll tell you, when we first started, we started with standardized dosing, just like everyone, but that was 3.5 years ago, almost now. Very quickly, I realized, wow, these people are nauseous. Wow, they're having side effects. We're going to have to send in a Zofran prescription, an anti-nausea. really quickly before microdosing was a word and that it was applied to GLPs, before another human being had ever spoken about it, we had already gotten down to half of the lowest dose, a quarter of the lowest CU. In the last year and a half, 2 years, I think I've prescribed one Zofran prescription preventatively in case they got nauseous. People simply don't have side effects when they're allowed to get small doses that are tailored to them.
I love that. And, I, as of recently, probably as of a year ago, started seeing a lot of people who either just started GLP-1 medication or trying to get off the thyroid medication or GLP-1 medication. So then they start reaching out to me saying, oh my God, I have this nausea, fatigue, muscle loss. And one of the worst side effects that I see on my side post fact is the hair loss. Terrible, just people come to my office pretty much bald, and it's heartbreaking. So, and no, it's not everyone, because you have to, if there is a right practitioner that starts you on the right dose and, like you said, advance you correctly and teaches you what to do on that journey, I think it's truly miracle drug. But most people or most practitioners are not like you. They don't have time to dedicate this one-on-one care protocols. They're just like, they're giving you prescription, or they see you once via telehealth, and then no one talks to you or checks on you. They're just constantly advancing. Of course you're going to have nausea and hair loss, and they completely destroy your gut health. So I started seeing patients and like treating their chronic constipation, severe. So we know that there's chronic constipation with thyroid disorders, with hypothyroidism, with decreased gut motility. And then you add the GLP-1 medication, and it's severe chronic constipation. So I had to develop like a guide that helps my, like more like a protocol, just because to help thousands of people, because it's such a big issue. And I know you have a guide that you guys, I think it's on your website and even on Instagram, that helps people to learn everything they can about the GLP-1 and help them on the journey. It doesn't matter if they just started the journey. It doesn't matter if they're working with you or not. I looked at the guide. It was super helpful. And we have an automated system, I believe, in live Instagram. So if anybody comments the word guide, you guys will get McCall's guide that they created just for their clients and for their clinic. So let me know if that works. Somebody comment the word guide, see if it works. This is the new function that we're
Oh my
testing.
gosh, I love that. How fancy.
I don't.
Yeah.
Hopefully it works. It works. But it just shows you that it takes a village to truly address weight
It's so
loss
cool.
all the direction. So we talked about microdosing, right? Are there any specific patients or conditions that benefits from this microdosing, or slower approach to GLP-1s? Do you see more people benefiting, some subgroup? Uh-oh, I think we lost McCall. Uh-oh. Technology is not on your side. Well, it's not on our side today. So we're gonna come back to our live. Do you guys still see me on Instagram? Oh, somebody commented guide. Let me know, KZ2222. Let me know if you got the guide, if you got a message from us. Oh, so many people commented guide. Somebody let me know if you guys got it. So we're gonna wait for McCall to join us again. But can you guys see me? Oh, can you see me? I know somebody said we lost McCall. Oh. Okay, so you guys got the guide. I love it, love it, love it. So the technology, some of the technology is working. I think we have McCall join us back. Let's see. Okay, you guys can see me. McCall, welcome back. While you were taking a break, A ton of people said that they received the guide.
Oh, good.
By
Okay,
commenting
fantastic.
the word guide, they received it. So that's
Yay.
lovely.
Hmm.
Now the guide I was talking about, so we have your guide. I also mentioned that I created a guide that helps severe chronic constipation
I
specifically
love
for
that.
patients on GLP-1. So guys, if
Okay.
you want that guide, you can just say the word constipation. Simple. So just the more information you have, the more help you have, the better it will be. McCall, I'm just gonna say the quality of the video is much better now. It sounds
Oh,
better.
interesting.
Sometimes we all need this reset, right?
I love it. I love it. Okay, well, good. It ended up being a win then.
Yes, yes. Now, I can't. I don't know if you heard me. I
Mhm.
ask you a question. Do you see that specific patients or conditions benefit from GLP-1 more than others?
Yeah. So, a couple thoughts there. One, I view GLP-1s as incredibly valuable for people. My people are women who
Mm.
are not able to appropriately influence their weight with effort. So, those are my favorite people to utilize these meds with, meaning, hey, I eat well and I exercise, and these are all the things I've done over the years to try to influence my weight, and I cannot lose weight.
Mhm.
So there's a couple things happening there. They're in this state of metabolic dysfunction, and a lot of people have thyroid problems, right? That's a lot of my people are thyroid people that lead to that metabolic dysfunction that are not able to appropriately lifestyle their way out of it. So those people, I think, benefit incredibly well from these meds because not only are they able to lose weight, they're able to reverse that metabolic dysfunction. They, lose their insulin resistance, they lose their leptin resistance, they optimize their blood sugar so that, and I know we'll talk about this later, so that long term they're able to actually come off of these meds. So that's one kind of subset of people. Another are people that are inflamed. So there is nothing that a human being can do, in my medical opinion, to reduce their inflammation as effectively as even the smallest microdose of a GLP. Not diet, not lifestyle, not sleep, not stress, nothing. These medications are incredibly potent and powerful anti inflammatory agents that is well documented in literature. And so many followers that I have, so many people will just immediately rebuttal with, well, you just have to change your diet and go on an anti inflammatory diet. And what I want humans to know about that is, listen, our inflammation doesn't always come from food. Like, that's not real. Can we eat inflammatory foods? Absolutely. Is that a huge problem in the standard American diet? 100%. However, a person can eat perfectly, and our natural physiology creates byproducts of inflammation.
Mhm.
That varies according a lot to genetics. Some people, like myself, produce an incredibly high amount of inflammation. And some people, very unfairly, like my husband, produce no inflammation. And,
Let's not
unfortunately, he
talk
has
about the
incredible
guys.
genetics. I
Let's
know,
makes me mad.
especially not like the South American ones, the Latin ones. They just have very good genes going on. But that's not the case for a lot of us. And so, in our physiology, day in, day out, we produce inflammation, and that can bioaccumulate over time and really create a lot of chaos, physiologically speaking. And these meds can, within hours, turn that inflammatory response down. In my own data set, which I believe Modern Thyroid Clinic has the highest data set for people with thyroid conditions on GLP-1s in the world, after one injection, inflammatory markers are reduced of a quarter of the lowest dose. So, if a microdose of these meds can influence measurably a reduction in CRP up to,
Mhm.
I've seen 60% in one injection.
Wow.
So, inflamed people, this can be life changing for them. And then I forgot your other question. I know who these meds are the best for, and then I forgot the other one.
No, this is this. That was the question I asked. Who would
Okay.
benefit the most? And you said people that have inflammation, not just want to lose weight. There are some people
Mhm.
I personally know that take the GLP-1 for non-weight loss
Oh, absolutely.
victories. So
Mhm.
you exactly you answer the question spot on. And so yesterday I asked on IG story for questions. People submit the questions so we can answer some of them. I printed pages and pages of these
Yeah.
questions. And one of the question, somebody said, how long does it take to see the results for decreased inflammation? And you said 24 hours, 60% reduction in CRP1. Have you guys ever measured like calprotectin or like a stool test to see if the inflammation in the gut decreases post fact?
I have not, but absolutely gut inflammation decreases. So gut inflammation decreases. GLP-1s also reduce the severity of gut inflammatory responses like the mucosal lining shedding off mucus from inflammatory agents. It increases beneficial gut flora and decreases negative gut flora. I think it's absolutely the future treatment for things like ulcerative colitis and Crohn's disease, inflammatory gut conditions, IBS, IBD. One of the most common things that we hear with our patients, clinically speaking, is my gut is so much better. Like, yes, can it cause constipation at higher doses and even sometimes at lower doses where your guide would be incredibly valuable? Sure. But the overall inflammatory response, the nature of people's gut issues, reduces significantly, massively, which isn't really a surprise, right? You and I both know the gut is like ground zero for inflammation. And so if there's these large reductions in inflammation in our body happening, we know most likely it's definitely affecting the gut from an inflammatory perspective.
Absolutely. I love to hear this hard numbers. Like this is not just like, oh,
Mhm.
we're just guessing at it. There is
Right.
research already that came out, and you guys are doing. You've been doing this research for what's at least 3 years now,
Mhm.
officially. Um, Somebody said in one of the comments, they said that by taking GLP-1, her TPO antibodies drop drastically. That's another
Yeah. So I was not.
inflammatory
Mhm.
marker.
Absolutely. That is, and it's measurable, which is so cool.
Mhm.
I did not really expect that going into this when we launched our internal program using GLPs and very quickly realized that they were having an anti-autoimmune effect. So almost, I don't want to say ubiquitously, but almost ubiquitously across the board, we consistently see Hashimoto antibody reductions. Full
Mhm.
stop, which isn't surprising, right? There aren't formal studies that are happening right now, which we should really conduct one on GLPs and specifically Hashimoto's, but they've already been shown in research to reduce psoriatic arthritis, to reduce the progression of MS, even on an MRI, like visibly
Mhm.
data objectively speaking on an MRI. Psoriasis in general, like we're already looking at the autoimmune impact of these meds. We know they're anti-inflammatory agents. We know that inflammation, what drives autoimmunity. So Hashimoto's is just another incredible manifestation of the effects of these meds on autoimmunity and the inflammatory response.
And that's why I had to bring you up here to this community, to Hashimoto's community, because I think now not everybody needs to get on this microdosing, but I think there are people, there are subgroups that will benefit from it drastically without triggering,
Mhm.
especially when working with interdisciplinary team, dietitians, physician assistant, the whole
Mhm.
team. I think they'll truly can improve their Hashimoto's through things that diet or exercise or stress reduction, no amount of
Mhm.
breath work can do for them.
Mhm.
And I see it in my clients. Now, of course, if, like we said, if you're doing it wrong, you will see all these side effects. And it's very scary to experience that. Now, somebody asked, can you give a reputable peptide company where they can get peptides? So I can
Mm.
give you guys, I can give you reputable. There's right there, McCall McPherson, Modern Thyroid
Yeah.
Clinic. That's a good. I know you guys expanded
Yeah.
through other states now. You do
Yeah.
telehealth. You can. So can you tell us a little bit about how people can get their hands, on you, on your team, and on your peptides and GLP-1s?
Yeah. So certainly. So at Modern Thyroid Clinic, we're in 46 of 50 states. We'll be in all 50 and any day now. We expect it any week. So we're just wrapping up the final 4 states. So we can serve people, obviously, for thyroid, for hormones, for GLPs, those sorts of things across all barriers. We have taken our little peptide GLP program and we have replicated it and put it into an entirely different sister company called Modern Weight Loss. So specifically for GLPs, we have expanded access in that way, maybe for people who don't necessarily need to come and see us for thyroid to join in this program and who simply exclusively want to participate in these other aspects of care. So we are trying so incredibly hard because I know it is very exceedingly difficult to get access to, you can get access to these meds, but it's really difficult to get access to meds with the actual support that you need to be successful. And part of what makes our programs unique is we put people on these meds under the pretense that we want to take them off of them long term. And so we have particular algorithms and things that we're looking for and working towards from a data standpoint that show, hey, these people can likely come off of this and successfully maintain their weight. And so that's also what we're looking for. There are people who don't want to come off. There are incredible longevity benefits to these medications. There's not really other meds out there that, like, when you're on them, your chance of dying is reduced by 20 to 30%. Like, for any reason, getting hit by a bus or a heart attack, your chance of dying on a GLP is less by 20 to 30%. So some people, of course, want to stay on them, but we always try to support people in a way that in the future they could potentially come off, which is really cool.
Speaking of dying and scary things, somebody asked, what are your thoughts on thyroid tumors and the GLP-1s?
I'm so glad you asked this question. Yeah, thank you for doing that. So it's fascinating, guys. I'm going to be honest. There is this cycle in the media with GLPs where we just cycle through different various things to be afraid of. And I want to blanket this statement with, I have never seen a medication with a lower side effect profile, and I've never seen a medication with the amount of benefits as these meds. Those two combined are going to change medicine forever. We will never be the same after this. This will be the biggest medical advancement that'll happen in my lifetime. I truly believe that. But somehow we always just focus on these cyclical fears. And one of them always has been thyroid cancer. And so where that came from is there is a black box warning on these medications that occurred because when we did studies on rats, which happens before we pursue human studies, there was an increase in a very specific type of thyroid cancer called medullary thyroid carcinoma, which is one of the most rare forms of thyroid cancer. It accounts for less than 3% of all thyroid cancers. What I need people to understand about this is rats were given anywhere from 20 to upwards of over 100 times the dose a human being receives. And they have incredibly dense GLP receptors on their thyroid gland. So they were flooded with this crazy high amount of GLP, and so much of it went to their thyroid. And there was an uptick in medullary thyroid carcinoma. From that, the FDA allowed a black box warning to proceed on GLPs in general. Now, human studies have been done. Meta-analysis, which is the highest form of a scientific study, has been done not once, not twice, on numerous occasions. But the biggest one of all time came out probably 6 months ago. And it was an international study, multi-continent study that looked at other diabetes meds compared to GLPs and the rates of medullary thyroid carcinoma, or any thyroid cancer in general. Clearly delineated, there was no increase in risk with thyroid cancer for GLP users, full stop, not even medullary thyroid carcinoma. This is obviously in humans. And it really put a nail in the coffin of that narrative. For years when I first started using them, because I'm in the business of thyroid, obviously this is a sensitive thing for me. I would make our patients go get an ultrasound every 3 months because I'm a crazy person. And 1, I wanted to make sure they were safe. 2, I wanted to make sure we were not harming them. And 3, I wanted to collect the data to see, hey, is this a real concern? Long before the meta-analysis came out, I really quickly realized, no, this isn't really a concern. Like, this isn't happening. It's not showing up. These people, some of them have been on it for years and years. No increase in risk for thyroid cancer. And the studies that are out there over and over again that show increased risk are poorly done, poorly analyzed, and just not real. So, in my opinion, that is not a risk to be worried about. And then you combine that with that result of the research with the potential benefits, and not even the potential, the benefits that these meds give for heart disease, heart attack, stroke, cancer. There's anti-cancer properties of GLPs. Like, we're talking about them giving cancer, 13% reduction in breast cancer risk, according to studies. So many, a study came out this week looking at, I think it was 170 cancers risk reduced on GLPs. So we need to flip the narrative. I'm so glad that you're participating in flipping that narrative as opposed to propagating more fear and discourse around these meds, because people, they deserve to know what they have to offer, and they're not being told.
We're providing the information, and the ultimate decision to get on that medication, it's up to that person, because that person knows their body the best. And yes, we need to remember that GLP-1, yes, it's used for weight loss right now, or anti-inflammatory and this and that, but it's been used for decades as a diabetes education, and they compare people with diabetes and people, healthy population, and people just taking thyroid medication. There is no increased risk of thyroid cancers or tumors, just, benign or not. And I just had the conversation with Rachel Baller, and she specializes, she's, nationally recognized dietitian. She specializes in cancer prevention. And she says that inflammation and Hashimoto's increases your risk for developing 13 types of cancer, threefold, or whatever the number was. Don't quote me on that, but it's huge. So whatever we can do, aside from anti-inflammatory diet and stress reduction and exercise and all of the stuff that we're preaching every single day, but there gotta be another way, maybe a little help that we all need and struggle with. So I know we have you for another few minutes. I do want to, for personal reasons, I want to talk about NAD plus and BPC 157, because I personally take it.
Yeah, same.
So what are your thoughts on it? Who should take it? Who shouldn't take it? What are the, tell me. Tell me.
So NAD is, as we age, we produce less and less NAD. Less is available to us, and NAD is important for so many things. Inflammatory reduction, for sure, but energy, mitochondrial function, cognition, performance, recovery, healing even. And we sleep, recovery in terms of sleep. We deplete naturally over time. It is a normal physiological response. And as NAD depletes, health issues increase, right? And so finding ways to replete and replenish that NAD can not only impact our performance, our cognition, our ability to effectively do our job and show up in our families, it also can help reduce inflammation, slow down aging. Inflammation is what drives so much of our aging. If we can turn the volume down on that, we slow the breakdown of our body over time, and it just has incredible benefits. I view it as extremely safe. People always jump to one study where it can show an increased risk for cancer. And really, when you analyze that study, it's poorly run, poorly done. And the researchers behind that are really on the forefront of NAD research look at that study and they're like, yeah, no, that's not valid at all. I know, because I've asked them personally. I've went to them.
Because you personally take it. So you're like your own guinea pig, because we're on this early stage of this NAD, any peptides for decreasing inflammation. So you and I are truly guinea pigs. So of course we're going to do our own research. So
and NAD is an endogenous, it's endogenous to us. We have it, we produce it, we need it. This is not something foreign that was created outside of our physiology that now we're putting into ourselves. No, this is something that we inherently have and lose as we age. So I do oral NAD every day. And then I also do NAD injections. I do them twice a week, most of the time. Sometimes I'll do it only when I need them, but I do oral religiously. I fell off the wagon for about 6 or 8 weeks, and I absolutely felt it 100%. Felt it when I restarted it. And then BPC, I've been doing BPC injections for almost a decade now, off and on. So
Wow.
certainly before people were talking about it, I was definitely doing it. And it can do a few different things.
Mhm.
BPC, what it is again, it's an endogenous compound that our body produces to constantly renew the lining of our stomach. Our stomach has high amounts of acid in it. And so obviously, if it were left to its own devices, it wouldn't be there anymore. We would just erode it away. So BPC is a powerful way to replenish that lining. When you take it exogenously, you can do it for a couple different reasons. One is it is a powerful, powerful tool for gut healing, obviously,
Mhm.
right? Like it can repair the lining of our gut. So think upper GI irritation, think leaky gut, think inflamed gut due to antibiotics, inflammatory foods, dysbiosis or a bad bacterial imbalance. And then the other thing that it can be used for is performance and recovery. So, in the same manner that it can replenish our stomach lining, you can take it in an injection and just proximally, let's say if you have a shoulder injury, inject it into your shoulder area. It doesn't need to be in the joint space, anything like that. It will trigger ligament, tissue, tendon repair and renewal.
How long
It's
does it
also
take?
Yeah. So most of the time for that specifically, you do like a 10 to 12 week cycle and you inject it twice a day. So a lot of people will feel improvement in the first few weeks, but you
Mhm.
continue through the whole cycle just to trigger repair. And then for people with gut issues, you can do an injection, but you can also do it orally. So it's most potently absorbed in your intestinal lining and your GI tract. And it's an anti-inflammatory agent as well. So much of these conversations I love because they've evolved to deal and include inflammation, which personally I struggle with. A lot of my patients struggle with. And I think more people struggle with it than they even realize. So finding ways to mitigate and influence that is incredibly powerful for our long-term health.
I love it. You summarized it perfectly. Now, the only thing what I've researched is the best way to get the NAD plus BPC. It's
Mhm.
through the injection.
Yeah.
The injection
So
is the best way. The oral, it all depends what company it goes through.
totally.
Yes, I wouldn't even,
Yeah.
if somebody asked, would you recommend an oral supplement? And it's so iffy with that.
You
Like,
have to get a great
Mhm.
one. You do. And it's got to be a precursor. It can't actually be oral NAD. That's not going to work. You have to get a precursor of it, like NR, NMN, those sorts of things. And there's a couple companies that I love. True Niagen is one that I've used for a long time. I'm starting to experiment with a new one that's also really bioavailable. And truly, I was my own guinea pig with that. I took it for a long time and then I stopped and I felt it like a decrease in my cognition, my energy, my performance. So I'm back on it and I absolutely can tell a difference.
I love NAD plus as an injection. I do feel the difference. I take
Yeah.
BPC 157. I inject, well, my husband injects around my knees because I used to be
Uh-huh.
a runner. I love to exercise. So I
Mhm.
do think it really works. Only been taking it for 3 weeks, but I think it
Mhm.
works. And I mean, it's cheaper than doing stem cell therapy or
Yeah.
a knee replacement, which I think I'm going to end up doing. So I'm doing everything I can as a preventative.
Yeah. And you
So
are way too young for a knee replacement. You got to buy yourself some time,
exactly.
sister.
Thank you.
Yeah.
Thank you.
Yeah.
That's why it's so important to have this conversation, to let people or to create the awareness. And I want to freely talk about this. I don't want to be embarrassed that I'm taking peptides or injections, and my husband is doing my shots in the knees because I pass out as soon as I see a needle. So here's
Yeah. Sweet husband. Good job, husband.
yes. So McCall, I know you have to run, but if we still have few people in the chat there. Again, guys, if you need McCall's guide on that will help you kind of guide you through successful GLP-1 journey, you can comment the word guide. If you want to treat severe chronic constipation on the GLP-1, you can say the word constipation and you'll get the guide. Now, we'll put all the guides, the links to your clinic, to your services,
Thank you.
the supplement company that you mentioned. If you would like to share that with me at the end, I would be happy to include that. So, thank you so much for your time and your knowledge. I would love to, I can have conversation with you for the next few
Same.
hours.
Let's do this again.
Let's do this again. Yes.
Yeah.
Since we had technical difficulties and we had to cut our time short, I would love to have you for another podcast. And guys, listeners, viewers, thank you so much for joining. Thank you for submitting all your questions. We're going to have to get to them, McCall. So,
Yeah, agreed.
until next time, thank you so much for your time.
Thank you for having me.
Bye.
Bye.